Hello, in this video, I will be talking about guilt and breast cancer. Before I do, I'd love to invite you to subscribe to our channel. We put out about 3 videos a week, so there's always something new to watch. So one of the things we see commonly in people with any serious medical condition is this question, why me? And that often turns into, what did I do to cause this? There's a lot of inclination to make sense of things that don't make sense. And it's my observation that people often would rather feel guilty than out of control. So if I can understand what I did to cause something to happen to me or in my life, then perhaps I can say, well, A led to B and B led to C, etc. It helps us put together some of the mysteries and helps us feel that we had more agency in why something happened to us, even if we sometimes take that on as a burden, the burden of guilt, that I did something wrong. So this is a very common thing that happens whenever something disruptive happens in life. And it's sort of paradoxical and counterintuitive that you're going through something so hard and you're turning that inward. But again, if we understand what we did, we can make sense of the world. And also, some people believe that if I understand what caused this, I can keep it from happening again by changing my behavior. So if I understand what I did, maybe it's my anger at my mother that caused the breast cancer. It means if I'm no longer angry with my mother, easier said than done, then I can keep this from coming back. So there are a few things going in. We really don't like mysteries. Sometimes mysteries are good, but a lot of times we don't like not being able to put things together. So it's a natural inclination, and understanding that can help you, I think, understand why some of these thoughts and feelings come up. So what do we mean when we talk about guilt and breast cancer? One is the cause. What caused the breast cancer? Was it something I did or something I didn't do when I was younger? One thing that's not uncommon is for people to feel guilt that they didn't pursue an abnormal finding on either self-breast exam, or a mammogram was done and the advice was to follow that up in 6 months, and somebody's later diagnosed with breast cancer, wishing they had done something differently, that they had, for example, pushed to have a biopsy done 6 months earlier. Other times people will feel that some attitude that they had, a negative attitude or some negative feelings they had, caused the cancer. Other people feel that it's a lifestyle decision. For example, if you lived on the wild side a little bit in your younger years, you may feel that that is the cause of your breast cancer. If you've watched our other videos, you know that's actually not true. And in over half of our patients, we don't know what caused their breast cancer. So it's important to know that there are very few individual behaviors that change outcome. In terms of a delay in diagnosis, if somebody goes to the doctor and comes with an abnormality that isn't pursued in that moment, and then 3 months later something is found, it's very unlikely that doing something different 3 months ago would have made a difference in treatment or prognosis. Even the most rapidly dividing breast cancers are, for the most part, treatable. And if they aren't treatable, they probably would not have been 3 or 6 months ago. So I know that, we believe early detection equals cure, but that's, again, what we use when we campaign for early detection. In a given individual, a couple months or even 6 months may not make a big difference. In people with neglected breast cancers, perhaps you're watching this on behalf of somebody whose cancer was probably there years ago and they never brought it to your attention. Sometimes people feel guilty, or their family members and loved ones may feel guilty that they didn't detect it, they didn't know about it sooner. And that can lead to guilt in the whole ecosystem of the family or the community. So there are a lot of things that can give rise to guilt, even including the diagnosis. After being diagnosed and treatment has started, there are some things people feel bad about, whether it's guilt or something similar to that. People can feel bad that they're not fulfilling the roles they always have. If they've always been the person on top of all the family finances or the home repairs, and now they need some help. They need to get somebody to come in and do those things, or they're not quite on top of things. People can feel guilty. They feel they're letting other people down. Sometimes it's our very own illness that can make us feel we're letting other people down. We were the strong one, or we were the healthy one. If there are other people in the family, whether it's a child, a sibling, a parent, or a partner who is ill, we may feel that it's our job to hold them up and support them. And now that we're going through something quite serious, we don't have that capacity or the time or the energy to do so. Our schedule doesn't allow it because we're at our own appointments. So that can give rise to a lot of guilt. If we're not used to being the center of attention, we might feel guilty. We might feel we're taking something from other people and needing it for ourselves. So a lot of these things can arise to cause us to feel guilt or even shame that we've done something wrong, that there's something wrong with us. So how do we combat this? Well, there's certainly the approach of cognitive approaches, getting the facts on what causes breast cancer, understanding that 4 wild years in college probably did not give us enough exposure to whatever we're worried about to cause breast cancer 20 years later. Those sorts of things that we didn't push to have more diagnostic testing done, those sorts of things, going through the cognitive pieces, the facts, what I said at the beginning about a delay of 3, 4, even 6 months. Once you're diagnosed, looking back, going back in time probably would not have changed what treatment you need or maybe even the stage of the cancer. But cognitive approaches aren't often enough. Sometimes we need to really dwell in our feelings, and we've talked about feelings a lot in our other videos. Just naming your feelings can be really helpful and not repelling them. If we push our feelings away, they can actually get larger. They can consume more of our energy. There's something about putting our feelings out on the table and looking at them, whether that's figuratively or literally, just saying, that's my guilt, that's my anger, that's my shame, can be really helpful. And a lot of these emotions thrive in the darkness. So talking with other people who've gone through things like this and asking them questions. Do you ever feel guilty that you're not able to do everything you used to, that you are now requiring care when you're used to being the caregiver at work and at home and your family and your community? And just realizing that you're not alone in these feelings can be really useful. In fact, we're making a video, so it must be not that rare to have these sorts of feelings. We talked about blaming ourselves and blaming others. The thing I would ask you is, how is that serving you now? How is that helping you show up in your life the way you want to? If you're blaming another person, can you go back and change the past? Is there a way to do that? Releasing blame can be a first step in healing from some of these really difficult emotions. There are some other things you can do to release emotions like blame and guilt. You can write them on a piece of paper and then tear it up. You can set fire to a little Post-it note. You can put something in a box. Some people have a God box or a higher power box. You can put those feelings away and try to let go of them. And again, ask yourself, how is this serving me? Maybe it worked before and it's played a role, but right now this is causing me to feel worse and not to behave in ways that I want to. Perhaps you're spending more time thinking about the past than the future. Exercising a great deal of self-compassion. You made the best decisions in the moment. You listened to the medical team when you decided to wait before you got attention. You did everything you could in that moment. Looking back, we can always look back on things, conversations we've had, decisions we've made, but in what way is that serving you? There are ways to change your outlook so that you can see things in a more positive light. It takes practice. You can start with gratitude. And I don't mean gratitude for the stuff you have, or at least gratitude. You can watch our video on gratitude, because I really discourage the at least these terrible things aren't happening to me, because it requires comparison. Actually, you have to compare yourself with people worse off to feel grateful. Rather, being grateful for the things that you do have in life, for not the things that you've lost, but for the things that you have, especially the kindnesses that people are showing you, whether they're strangers or people that you've known for a long time. It's not unusual to require some support, whether it's professional support or peer support, if you find that feelings of guilt are occupying more than an hour or so of your day. If you're finding that they are, if they're taking away the joy in the things that could bring you joy, it may be time to get into a support group. And professionally led support groups can be very helpful in this regard. Sharing your experiences with the Yerbba community can be helpful. And talking with somebody who specializes in the emotional life of people going through cancer treatment can be really helpful. Talking with a social worker at your oncology practice, or reaching out to your primary care doctor to get support. There's a lot of support in communities. You can reach out to a therapist or a counselor to get help navigating some of these difficult emotions. The way I feel about this and the way I think about it is you're already going through a lot. To add the burden of guilt to yourself is not going to help you get through this any better. In fact, it may drag you down. And if you are having a hard time releasing that, there are approaches that can help. And I would encourage you to reach out for support. Again, if this is taking a lot of time during every day and interfering with your ability to feel joy and to move forward, reaching out and getting more professional support can be really helpful. There are two other things I want to say. The first is, don't believe everything you think. We can get very caught up in our thoughts being reality. We can think something is true when it might have a shade of truth, but it's not absolutely true. So when you're looking back over your life story and you're saying, well, this happened because of that, ask yourself, is it true? Is it absolutely true? Is it possible there's another truth? And then finally, I'd love you to think about purpose and meaning in your life. Purpose is forward-looking. What are you here for? What do you stand for? You can complete this sentence. I refuse to believe that, and complete that. That can help you find your purpose. And I am not trying to make sunshine out of a terrible situation. Breast cancer is awful, and its treatment is awful. But you have a purpose. There's a reason you're here. And finding that in everyday moments, I think, can really help with these feelings that hold you back. I hope this has been helpful. Drop a comment or question below. We try to get back to you within a couple weeks. You can go to yerbba.com to get your personalized report. As always, thank you for watching.